You have got to listen to this podcast episode because autism is a risk factor for becoming tempted or being pulled into highly risky, experimental, dangerous surgery procedures and hormonal treatment procedures based on their insecurity, their loneliness, their confusion around identity, and their desperate longing to belong into a community of young people. There's an explosion in gender dysphoria, and autistic children are high on the list. There are certain people who have a very dark agenda and they want to get to your child. I want to tell you about their dark agenda, what you can do to prevent it, and why it is that so many autistic children and young people end up in these high-risk procedures and end up actually maybe ruining their lives, their kidneys, their mental health, their urinary tracts, their ability to have a bond with a child in the future. It can cause infertility, it can cause a complete lack of sexual pleasure in the future for them. These decisions are so horrific for them to make at a very young age, but that's the reality. Listen to this podcast episode. Subscribe and like this video as well so that you don't miss the next episode, and let's get into it. Would you, as an autism mom, allow your child to be around people who had an end goal, and that end goal would be to convince your child to have invasive surgery or hormonal treatments that is almost guaranteed to remove any chance for them to have babies in a natural way in the future, something that's going to increase the risk for diabetes, kidney disease, high blood pressure, joint and bone disease, anxiety, depression, suicidal tendencies, tumors, painful pelvic pain, chronic urinary tract infections, violence, mania, psychosis, blindness, weight gain, baldness, acne, sleep apnea, risk of dementia, premature death, blood clots. I'd say no to that one. I would say that's a pass for me. Nevertheless, there's an increasingly explosive tendency for children with autism, young people with autism, being coerced into, being tempted into the gender dysmorphia community. In fact, it's so serious that the gender reversal clinic in the UK called Tavistock has closed down because the majority of the children who came there to get a sex change were children with autism, and they had no idea how to deal with them. And so what we are seeing and what they saw is an increasing number of children and young people with autism who try to solve problems like feeling lonely, feeling confused about their identity, feeling bullied, not really understanding who they are and feeling like they don't belong anywhere, and also anxiety and depression and even suicidal thoughts. Solving those issues by agreeing to surgical or hormonal procedures that will destroy the body for life without being prepared for or without having an understanding of the lifelong consequences, physically and emotionally and practically. And this is a disaster. And I want to talk to you in this podcast episode about why this is a tendency, why it's particularly affecting autistic children and young people, and how you can prevent it, why we are being lied to as parents by these clinics, and and how it's now becoming political, and it's now lawful for the clinics and the specialists and the experts and the therapists to actually affirm and agree with the children when they say, I think I'm a boy, I think I'm a girl. They are no longer allowed to ask the questions that I'm going to ask on this podcast, and that the questions that every therapist or psychologist should be asking before ever letting a child, which is outrageous. It should never be allowed for children under 18 to have gender reversal procedures done to them, but particularly not without asking the questions that we're going to ask on the podcast today. So here are some statistics and some scary facts. There are no studies done on gender reversal and the long-term regret rate. So there are no studies done because it's so fairly new, and it used to be something that happened very rarely, but there are no long-term studies showing how many of these young people regret when they are older. We can see a lot of these stories popping up on YouTube, on podcasts, and ex-transitioners speaking up about this. But when parents are told by experts in these gender reversal clinics that, one, the regret rate is low, it's a lie, because it's been proven in the studies that their own literature tells us that they don't have any long-term studies determining the regret rate. And when parents are told that if their children are not allowed to go through this gender affirming reversal or just changing of their sex, that they are in a higher risk for suicide, that's also not true. Because you can't have, this is something that Jordan Peterson has talked about extensively, and I'm going to link to an interesting podcast interview that he did with an autistic girl who went through this procedure and has had massive regret and extremely serious side effects and lifelong consequences that she's regretting big time, and no preparation, no informed consent, and no responsible parent, no responsible adults in her life to prevent this from happening. In fact, her parents were coerced into this, and she said that she's been manipulated into this extreme procedure at the age of 14. So when parents are told, and that's what her parents were told, that if you don't go along with this, you risk losing your child because suicide rates are very high for these children if they are not affirmed, which is a lie, because as they know very practically and clearly, there are no long-time studies on these children and adults and the regret rate. So we are being lied to. It's a very dangerous procedure. It's highly experimental, and we're going to dive into what is it that they do to our children and what is it that they don't tell our children. How do you increase the risk of your child ending up in communities that will increase the risk for this being an issue for your child? How do you avoid that early on? And what do you do if your child is suddenly talking about wanting something as extreme as this done to him or her? What do you do to stop this, or at least prolong the phase in which they can make the decision? Because statistics show that 80% or more of children who are left to do nothing, you're just left alone with these confusion and these confusing thoughts and their gender dysmorphia, they end up actually feeling comfortable about the biological sex, the body that they were born with. So let's talk about it. So what are some of the risk factors for young people? Who are these young people who end up wanting to do something as drastic as surgically removing sexual organs in a highly experimental procedure, which is extremely risky and dangerous and causing a lot of disabilities and health issues and mental health issues on a lifelong basis, who are at risk for making a choice like that in an age where, think about how you were feeling when you were 13, 14 years old as a neurotypical person. Certainly I didn't know myself at all when I was 14. There was a lot of experimenting and experimentation when it comes to who am I? Am I this type of person? Am I that type of person? Even just down to what type of clothes did I want to wear? What type of political opinions did I want to have? What type of romantic preferences did I have? There was a lot of confusion. And a lot of the confusion that we have when we're teenagers is also based on traumas that we've had in our family, in our biological family, bullying in school, feeling uncomfortable in our bodies, feeling lonely, feeling confused. And so a normal trait in teenagers, this is something that happens to all teenagers as they go through puberty, and it lasts for years, is confusion, a tendency for feeling awkward about their bodies or body dysmorphia, feeling ugly, feeling like they don't like the body that they're born in, that they hate their breasts, they hate the way that they look, they want to look differently. They look at all these people on social media with all their perfection and they feel less perfect than them. They want to be something else. They want to be different. Depression and anxiety is also part of that for more and more people. And with the spread of social media and the amount of time that kids and young people spend on social media, scrolling through pictures of other people and their bodies and comparing themselves to this, has caused an explosion in anxiety and depression and sadness, particularly in young girls. So it's part of life and it's part of growing up to feel uncomfortable, to feel lonely, to feel bullied, to feel like you don't like your body, to feel confused about who you are, to feel anxious and depressed. That is normal. That is also a risk factor when it comes to being tempted into this whole gender identity. I'm going to give you some examples as we talk about this that's been super scary to me. But I just want to say too that one of the risk factors and one of the most common traits in people who are seeking these procedures, and we see it with the detransitioners also, with the podcast interview that I'm going to link to in this episode description on my website, and that is that autism and ADHD is also a risk factor for getting tempted into this extreme procedure. And so when Tavistock closed down in England, it was because the staff were not equipped to deal with the extra challenging aspects of having a client who is applying for life-changing, experimental, hormonal and surgical procedures, and they have a diagnosis of autism or ADHD on the side. So their ability to think about long-term consequences, their ability to understand themselves and their bodies and relating to other people and looking into the future and imagining life without a penis, life with a fake vagina where you have to dilate every single day in a painful procedure. This is what happens. We're going to dive into the awfulness of these procedures in a while, in a moment, but being able to look into the future and imagine the pain and the consequences of that, the pain and the consequence of never being able to breastfeed a baby, the pain and the consequence of never having a sex life or erotic or sexual pleasure in your marriage is not something that's easy for someone with autism to be able to take in and reflect upon. And with these procedures, sometimes it happens when children are 14, 15, 16, the procedure starts with the hormonal treatments as well. This girl that Jordan Peterson, who's autistic, spoke to, she had a mastectomy before she was 17. I mean, it's demonic stuff. It's so incredibly scary to me. Let's say your child is experimenting with the way that your child wants to look. Just whatever child we're talking about. Let's talk about a 14-year-old child. Your 14-year-old child, if a child comes to you and says, "Mom, I want to look Chinese. Can I have a plastic surgery? Can I have plastic surgery so that I look Chinese?" We would probably think twice. We would probably say, "I think you should wait." We would probably not allow face tattoos or plastic surgery that would be life-altering or looks-altering. We wouldn't allow that in a teenager. Yet we are allowing much more experimental, comprehensive, destructive surgeries and hormonal treatments. We're allowing that to happen to 14, 15, 16-year-old children. It's irresponsible, it is sickening, and the fact that it's becoming the law that you reaffirm an autistic person who comes into your office and says, "I think I'm a boy," when they are biologically a female. And they don't give them the time to reflect. They don't give the brain the time to fully develop and comprehend consequences of decisions like this. Is absolutely criminal. And I wanted to say that before diving into what exactly is this procedure and what kind of health consequences does this procedure lead to, because that is scary stuff as well. So let's just reiterate the fact that the regret and the consequences is unknown. The regret factor and the consequences, it's unknown. But we know that the brain is not fully developed when we have teenagers who make these decisions. We know that in puberty, our children do often struggle with depression, insecurity, and awkwardness, and with autism that is particularly true. We know that the psychosocial and somatic long-term consequences of gender sex change is unknown. And we also know that the risks and the common traits in children and young people who go for these types of sex change procedures, the common traits is that they have some sort of disability, ADHD, autism, or neurodiversity. They are often bullied in school or in their peer group. They struggle with depression and loneliness and a feeling of not belonging, body dysmorphia. Many of them have been sexually abused, or they have some sort of giftedness. These are details from Jordan Peterson's work when he's talking about and interviewing autistic people who've been through this procedure, and he goes through the literature as well as a psychologist. And let's just restate that Tavistock in UK closed down because they found that it was not safe, that they were not focused enough on mental health, and that they were rushing people into treatments that caused them a lot of health issues, many of them with an autism diagnosis. So what are some of the consequences of these procedures? Well, we know that the girls and the boys, they are being treated with hormone suppressing medicine, so hormone suppressors. And we know that, and that's not even the surgical procedure I'm talking about now, we know that it can lead to no sexual pleasure, not being able to breastfeed their children if it's a woman, that's being reversed. And we know that for women, the long-term consequence of hormone suppressors, I've got a list here, so I'm just looking down if you're watching this on YouTube, that the long-term known consequences of these hormone suppressors is deterioration of bone health, infertility, cardiovascular disease, cancer, lack of ability to bond with children, no sexual pleasure. And when we go into the surgery, it's a complex, irreversible, destructive to sexual health experimental procedure. It can lead to confusion, it can lead to chronic urinary tract problems, sexual dysfunction, regret. And here's a list of the consequences of testosterone in females, which is what they are subjected to. So with testosterone in females, it causes a risk for diabetes, kidney disease, high blood pressure, joint and bone disease, depression, PCOS, tumors, painful orgasms, pelvic pain, urinary tract infections, vaginal atrophy, rage and violence, mania, psychosis, blindness, weight gain, acne, baldness, sleep apnea, risk of dementia, premature death, and blood clots. And is this really something that we can responsibly, as adults, as psychologists, as nurses, and as parents, allow for a 14-year-old, 15-year-old, 16-year-old to decide to do to themselves? Or do we need to have some boundaries and some rules so that we at least let these children grow up and be adults before they get to make that decision? I mean, we have rules for when you can drink alcohol, when you can smoke cigarettes, but we can mutilate and castrate children, let them do that to themselves before they are 18. And I find that incredibly scary, particularly when we are talking about autistic children or children with ADHD. I feel like when we look into the history of this whole trans agenda, transvestite and gender dysmorphia, but particularly the gender affirming idea of changing sex, which from a biological perspective, and honestly from a spiritual perspective as well, seems incredibly concerning. But even when we look at the history of how this came about, who are behind this, it becomes even darker. So when we look at who did the first procedures, who were the first advocates, and what type of persons were involved with this kind of thinking, it becomes dark and it becomes perverted. So transgender is a term that's invented by a psychiatrist by the name of John F. Oates in 1965. But already in 1960, there was a man called John Money, and he was famous and practiced gender medicine at Johns Hopkins Hospital in the US. In 1960, he transed a baby, twin boy. He was a boy. A couple had twins, and one of the twins, the circumcision went wrong, so the child lost his penis. And this guy, John Money, he offered to solve that solution by turning this child into a girl. And this transing of this baby failed horribly, because the story behind the story was that this guy, without the parents knowing it, the parents wanted to make sure that they could give this child a life without the consequences of this horrible tragedy of losing the penis. And they thought, okay, if he's raised and this was what this guy John Money told them, that if he's raised like a girl and surgically we remove the rest of the penis, he'll think that he's a girl. He won't have issues growing up. He'll believe that he is a girl. What happened in reality was that this man, John Money, he was abusing both of the twins when the parents brought them to him in the clinic at Johns Hopkins Hospital. And he practiced this gender medicine and sex reassignment on adults and infants. And of course, when this came out and when this boy grew up, he's been speaking out about this. He's been talking about the abuse and the way that this surgical procedure completely ruined his life. This clinic was shut down because of ethical reasons, obviously. So these infinite genders that we're talking about today is actually invented by and kickstarted by a pedophile. It's a byproduct of a pedophile madman's work. I would like to give children a space to be children, free from this insane sexualization that is rampant and increasingly crazy in this modern society. And if we look back at who's been involved in this narrative and this way of thinking where we say, okay, children are sexual from birth. Well, children are sexual from birth if there are adults involved. That's the way it's been with pedophilia and abuse all the time from day one with adults. And so if we look at Kinsey, the Kinsey Institute, which I believe it was founded in 1947, they and he studied sexual arousal in kids. You gotta think about this. How did he study sexual arousal in kids by masturbation in babies? Well, he did that by abusing them. And so it was an act of experiments through masturbation, and the data was collected, and many of the people involved allegedly were convicted pedophiles. And this led to the proclamation that children are sexual from birth. And his research, according to some of the moms who are now advocating against these sex change procedures, his research was founded by the Rockefeller Foundation. I don't think we need to go back in time and look at this. I just think we need to really question and use our discernment when we look at what's the origin spiritually and practically when we want to decide whether or not we want to subject our children to that whole world. And I think the story about John Money and the way that he invented gender medicine is enough. It should be enough for any parent to really feel and sense in discernment a lot of red flags, including when we have a school system, who's now looking to make it possible for children to make these decisions without parents' consent, but also a system who has turned it into the law in some states that you have to gender affirm when teenagers come and tell you that they are a boy, even though they are biologically female, that you then by law have to affirm it or you will lose your license. I mean, how did we arrive at this without massive backlash? And how do you avoid your child being tempted into this whole scenario? I want to say that I actually was, at some point, I had a TikTok profile. And when I was talking about turning symptoms like stimming and screaming and lining things up and ritualistic behavior and social awkwardness, when I was talking about how to turn those things around so that the child can get a better life, the people who attacked me the most violent way and gave me death threats and trolled me and just attacked me in the most vicious way were autistic young people who were into this whole gender ideology and all these different pronouns and sex change narratives. And so I do think that there's an evil streak in the whole agenda, and that when we get sucked into it, there's a lot of darkness and negativity and a lot of identification with not only the diagnosis, but the symptoms that are most troublesome when it comes to creating a life, a job, a relationship within society and function as an independent individual. It's almost like there's an agenda to destroy our children, and if we don't destroy them when they are, like, this is the dark side's agenda. Let's destroy these children by telling moms and dads that there's nothing you can do, so that the inflammation, the undermethylation, the inflamed gut, the infections and co-infections, the damaged mitochondria, the diet that's making symptoms worse, gradually destroy these tiny children's body. And if we're not successful in that, we make sure that we give it an extra go when these children enter into teenage years by including them into a cult thinking where they think that where they're longing to belong somewhere, and their confusion around who they are and their awkwardness is met by something very tempting, namely a community where they are included, where they are admired for their traits, where they are wearing their diagnosis as a badge, and where they can surgically alterate and change the things about themselves that they don't like. And even if they don't feel like they are a man trapped in a female body or vice versa, the thought of belonging, the thought of being included, the thought of being different and loved for it is enough to tempt vulnerable souls into destroying their bodies at a very young age in a way that will destroy their life and their mental and physical health for life. So this is very dangerous, and all the red flags should be flagging up. And when there's an autistic person or someone with ADHD who comes into these clinics, they should be turned away, and all kinds of interventions when it comes to psychotherapy, questioning these ideologies and giving these children time to reflect and grow and develop their brain and actually improve their health, methylation, gut health, in order for them to get to the best possible outcome and the best cognitive ability from which they can make better decisions. That's what we should at least give them, instead of just affirming and cater to something as mad as experimental, devastating surgical and hormonal procedures. Which brings me to the last but most important point that I want to make, which is, how do you prevent this from happening to your child? How do you protect your child from getting enrolled into these communities online and in school? And how do you protect them from these devious, evil experts who want to alter and change your child's sex and surgically remove their sexual organs and hormonally change their lives forever. It actually starts early, and if you are already in the midst of this, if you're in the thick of this, there are things you can do, and that needs to be done urgently as well. So first things first, how do we prevent this from happening? I believe that step number one is to prevent your child from getting into this whole ideology obsession. So I see a tendency in the autism mom community which can lead to this long term of taking pride in the diagnosis because it's a coping strategy. We are told in the established medical society and system and community that there's nothing you can do. And if there's nothing you can do, you need to get the most out of a terrible situation where your child is eloping, stimming, lining things up. And you can foresee a future where your child has no friends, can't communicate maybe, always need to be monitored and under supervision of some sort, maybe get into an institution later on in life, but always being dependent on someone else. And you might be fearing for their future because what happens to them when you die. As humans, we cope with hopeless situations by coping strategies. One of the coping strategies is to take pride in the diagnosis, to make it your purpose to get acceptance, to step into some sort of, it can be stepping into a victim role and advocating against the lack of inclusion of these people in society, rather than looking at, okay, here are the symptoms, what can I do to minimize the expression of these symptoms? How can I improve my child's mental and physical health so that symptoms improve? And there are a lot of studies. I've done a lot of podcasts. You can find them on my website, barefootautismwarriors.com, about how nutrition and nutritional imbalances and lack of brain development can cause all the symptoms that we see, from stimming, rigidity to aggression and hyperactivity and sleeplessness and lack of emotional and social skills and decision making, dangerous behavior, violence, all things that actually make life difficult and increase the risk for suicide, criminal behavior, institutionalization. Why would we want that for our children if we have tools to address it and change the outcome, change the future, and give them more independence as they grow up? Now, I know that children who are on the more, high-functioning spectrum, we used to talk about Asperger's, now we don't categorize like that anymore, but a high-functioning person is very different to children with infantile autism who cannot speak and who are screaming every day and eloping and lining things up and really struggle in life. So please don't, as a high-functioning autistic person who might be listening to this, or a mother of such a person, don't compare your life to the life of the children who have very serious issues when it comes to coping in life and communicating and simply functioning. But when we feel like there's no solution, we cope, and so we take pride in autism, we become autism advocates, and when you enroll in these communities that are based on coping strategies and pride and a tad bit of victim mentality, you pass that on to your child, and your child will identify with the diagnosis, take pride in the diagnosis, sometimes feel like a victim, and be angry about not being included in society. Can you see where this is going? So anger, aggression, loneliness, feeling like you don't belong, confusion about who you are, and this longing for belonging, and this obsession with your identity or your diagnosis or your problem or your dysmorphia or your disease or diagnosis. Always, I said that already, but this obsession with the label can turn into an obsession with either pronouns or gender dysmorphia. And if you have a tendency and an attraction to a pull towards communities that are very high pitch, very loud, very victim based, very aggressive, and very focused on getting affirmed in and catered to and protected in dysfunction. So from my perspective, all these different genders, it's a confusion. In many ways, the diagnosis itself is a confusion because we diagnose people with autism and ADHD instead of looking at the underlying biomedical and biochemical issues. But if we identify with our symptoms or our disease or our label, our diagnosis, and we turn it into like a badge of honor, that is something that can get you attracted into these communities where feeling like you're a boy when you're a girl, or feeling like you're a girl when you're a boy, or wanting to be part of something that is loud and something that is trendy and something that gives you a lot of attention, something that makes you feel included, it's very tempting. It's very tempting. It is no coincidence that the majority of young people who go into these clinics are autistic and have ADHD. So the data is there. So be very careful what you subscribe to as an autism mom when it comes to where you seek advice and where you try to fit in. Because many of these autism mom communities are based on a lot of rage, a lot of anger, a lot of trolling, a lot of aggression towards the moms who want to go down the nutritional and biomedical route and the natural healing route. And it's almost become politically incorrect and illegal to talk about turning symptoms around. It's not just almost, it has become. It has become. So stay away from the pride movement, from the autism advocate movement, and protect your child from identifying with the diagnosis. Even maybe protect your child from ever getting the diagnosis and focus on addressing the underlying issues in time, preferably before teenage years, before your child is 12 or 13. Keep your child away from autism communities. If this has happened, and I know I'm a mom with some really radical views when it comes to this. My child once had some really bad friends. I listened to an interview with a mom who saved her child from sex change surgery, and her daughter is now telling her that you saved my life. Here's what she did, and it's exactly what I did when my child got into trouble, my youngest neurotypical child, and got into bad company in Denmark with friends who were smoking and drinking and getting into all kinds of trouble. What she did, what I did, was state your values very clearly. What's your values in your home? In my home, the values are that we respect biology. We don't try to play gods and reverse the way that God has created us. My values are that we do not castrate or surgically remove sex organs, or we don't let 14-year-olds or teenagers make life-changing decisions. It's the adults who are in control. We decide what we buy. We decide what you're allowed to do and what you're not allowed to do. We have strict rules. We have boundaries. We have values. And these are the values that we stick to in our family. And you can protest. You can hate me. And he did. And she did. the mom's daughter who now feel that her mom saved her from this surgery. But then you remove the phone, you remove Facebook, you remove Snapchat, you remove the computer, you isolate your child from these friendships and these groups until your child has developed their brain and has had enough time to think and reflect and has had enough time to compare normal socialization, normal development, healthy friendships to extremes and very sexual oriented or extreme ideology focused or even destructive communities. And so my child, he had a whole year where he basically didn't speak to me, but in that year he actually developed his brain. He became more mature. He was forced to have and find healthier friendships. He started exercising. He started to eat more healthily because he didn't have Facebook and Snapchat and those people to go and party with. So you got to isolate your child. You got to protect your child from dangerous people and bad company. And one of the reasons, or one of the ways to do that, is actually to remove these channels that they communicate through. So, what's a conclusion? Well, I've said this before and I'll say it again. Autism is a wake-up call. It is in our life. It is an epidemic because it is here to flag up and show us all the things that are wrong in this culture, in this modern life, in our families, and in our values. So everything that is unnatural, impure, toxic, dark, autism is here to point out to us. And so we can either take that letter and create a culture around the letter instead of reading the message and change according to the message. So when we listen to the message behind symptoms, symptoms tend to go away. So we don't cater to the symptoms and accept the symptoms without a fight. And when we look at autism and ADHD and the way that a very dark side, a very sexualized part of society, a very artificial, actually very toxic part of this spiritual battle and existential battle in this world, the way that the dark side is trying to hijack our children and operate on them surgically, hijack them and change their lives, destroy their lives. When we look at the original story and the narrative and the people behind the trans agenda, when we look at the way that our children are being pulled into these procedures, the people who are completing and exposing our children to these procedures, and we link it to the agendas that we've been exposed to and victims of in the past 3 years when it comes to the schooling system, the established medical system, the political system. We have a tendency that has to do with removing authority from the parents, sexualizing our children, taking away authority, and creating a culture around confusion and worshipping confusion and worshipping symptoms and diagnoses instead of dealing with them and changing our children's lives. So I think we need to question the origin and the people who invented these procedures, who were linked to pedophilia, who were linked to some abusive and manipulative tendencies. We need to think about our children's future. We need to think about the fact that we are surgically and hormonally manipulating children to become a different sex with a lot of health and mental health issues, because of depression, anxiety, loneliness, and awkwardness, which is a natural part of growing up, being a teenager, and maturing into an adult. It's a catastrophe, and it has fatal consequences. And this is why I'm talking about this topic, even though people who talk about this topic get a lot of hate, not only from experts, but also from the confused young people who are doing this. The last piece of the puzzle I want to emphasize is, if you are a parent who get attention online, on social media, for transing your child, you got to really question your motive. Is there any sort of manipulation, any sort of narcissism involved in this? Because our whole society is based on that. If you're doing this from a pure heart and only in your child's interest, you wouldn't post about it online, because you would just then trans your child without anyone else knowing it. I cannot for the life of me understand how anyone would have the courage to do something as wild as letting your child surgically be turned into a biological sex that your child is not. So I hope this created some thoughts, and I hope this will protect children from being exposed to this. I hope that you'll be very vigilant and use your discernment early on in order to protect your child from the dark agenda. And I really hope that you liked this podcast, and I'm really curious about your comments. Send me a comment at contact@barefootautismwarriors.com, or your opinion. And if you need help, that's also the way that you contact me. Hope you enjoyed this episode, or at least that it made you think.